Hello my dear patients, welcome back to my channel. Today I bring you a super punctual video about surgical pins. Surgical pins are adhesives that we solder to the orthodontists when our patient is ready for orthognathic surgery. Who informs us that the surgeon who is going to operate him is ready for orthognathic surgery? Today I want to tell you how to put those surgical pins. These pins, the idea is that they go between tooth and tooth, soldered to the arch, both in the upper and lower jaw. For this to be viable, for them to be there, we have to have our patient in a 16 by 22 steel arch. It may be that the doctor has it in a thicker arch, but it is important that it is a rectangular arch and that it is made of steel. The patient has to be operated on steel arches, which are rigid arches. Our patient cannot be operated on an arch that is as flexible as a nitinol arch, always on very rigid arches. So when our patient arrives, we must have him on rectangular steel arches. And what we are going to do, as you can see in the video, is to mark between tooth and tooth. It may be that the mark is made with a Sharpie, with a non-erasable marker. It may be with a wax pencil, go marking, and we are holding the pin long, with pressure. And additionally, we are going to put a little bit of solder so that it is absolutely fixed and does not move. It is possible that some of them move during surgery, but from the office they all come out fixed. It may be that some of them come off, however the surgeon can use it that way. But it is important that they are subject. It is also very important that the braces are well cemented to the teeth, because in surgery our surgeon needs this to be absolutely still, to only have to worry about the cuts he is going to make, to place the osteosynthesis material, to suture, and not things that should not change. Change in surgery, such as falling the braces, or falling the pins, or releasing the arch. When we already have all the arches, the soldered pins, we take the arch to the mouth, and what we are going to do is hold it to each bracket through an individual ligature. There are cases where the patient has self-binding braces, and in some points, we can put individual ligature. But if our patient has conventional ligature braces, each tooth goes to an individual ligature, linked to the jaw, that is, forward. It is important that this ligature is folded at the tip and inserted below the arch, because our patient already has enough to have braces, have pins to have ligatures that suddenly suck. So this is how the pins are placed when the patient is going to operate. It is very important that the surgeon has communication with the orthodontist to see what pins he is going to put, how far the pins are going to go. I generally put pins up to the last little ball or up to the last space between little ball and little ball. I put them first pressed and then a point of soldering, and I always put an individual ligature. So my dear patients are ready for surgery. I want you to watch the other video on how to prepare for surgery and all the videos on how to recover. I love you very much. I wish you good luck in your surgery, and remember that there is always a preparation, and that is why I made the other video on how to prepare. Good luck with your surgery.